My name is Bilal Al-Kafaf. I'm a consultant surgeon and researcher in Manchester, the United Kingdom. Well, imagine you want to buy a car and you want to choose between a Ferrari and a Porsche. But before you spend your money, you go online and you look at some reviews. The first review compares the two cars in terms of performance, fuel consumption and engine. It does so by using top speed, urban fuel consumption and maximum power of the engine. And in this first review, the Ferrari is the winner. But to be fully convinced, you look at another review. The next review compares the performance of the cars using time taken to reach 62 miles an hour. Fuel consumption is now compared using extra urban fuel consumption, and the engines are compared using maximum torque. In this review, the Porsche is the winner. Now you look at a third review. This time, performance is measured as time taken to reach a quarter of a mile. Fuel consumption is compared using combined fuel consumption, and there is no mention of the engine. In this review, there is no outright winner. So how do you make your decision? Now let us take a look at gastric cancer. Gastric cancer is a leading cause of cancer-related deaths worldwide, and survival rates have not improved significantly over the last 4 decades. It's therefore especially important that we improve the quality of research in this field. Surgery to remove either part or the entire stomach is the main treatment available to potentially cure this type of cancer. However, surgery is associated with significant complications and major impact on a patient's quality of life. Now, when it comes to understanding which surgical approaches are best for patients, we need to be able to compare and combine outcomes from many different trials. As an example, we may want to explore whether open or minimally invasive surgery is better for patients. Ideally, we would want to see the same results from several trials to convince us that one is better than the other. From our research, we know that surgical trials for gastric cancer do not report their outcomes in the same way. We use the term outcome to describe an effect of a treatment, and our understanding of these effects or outcomes helps to determine which treatments are best for patients. One trial may measure survival at 3 years, post-operative pain, and to what degree the cancer is removed by counting how many lymph glands were removed during surgery. Another trial may compare survival at 5 years and use the length of time spent in hospital as a measure of recovery. And rather than look at how effective surgery is at removing the cancer, this study may look at how much bleeding has occurred instead. So how do we decide which treatments are best for patients?